Hello, I'm Dick Essey. If you had attended the National ALS Advisory Day dinner in Washington, D.C. on Wednesday night, May 8th, you probably sang happy birthday to me, even though I wasn't there. I had turned 90 a few days before, and Andrew Brophy said some very nice things about me on the occasion of my receiving an ALSA Lifetime Achievement Award. Unfortunately, I didn't arrive from San Francisco in time to make the dinner due to a cloudburst at Dulles Airport when my plane was arriving. I had planned on making a few remarks that night, but instead I'll deliver them here. In 1995, when I founded the Bay Area chapter of the ALS Association in San Francisco, which is now a part of the Golden West chapter, I solicited funds for medical research from a leading philanthropist in San Francisco. He told me, to him, quote, giving money for medical research was like throwing money down a hole. About 3 years ago, when I was serving my 15th year as a board member of the ALS Association, I attended the annual meeting of the board. At that meeting, the vice president of research made an announcement that for the ensuing year, because of a lack of funds, ALSA did not have $1 for new research for the ensuing year. They had enough to continue funding for projects that were in process, but no money for any new ones. Thinking about that evening, I thought if the word got out that we didn't have $1 for new research, we weren't going to collect anything that year. So the next morning, I made an announcement that I would contribute $100,000 for research, provided that all the other members on the board donated at least $1 each, and the total sum from the others had to equal or exceed what I was donating. And I wanted my money to go for research. They could request that, or they could request that the money goes for patient care, or perhaps wheelchairs and so forth, or even research if they wanted. A couple of months later, I asked the then chairman of ALSA, how are you doing on my challenge grant? And he told me, and I almost fell out the chair, that they had to date collected $800,000. Thanks to a sizable donation from one of the other board members. After that, I had forgotten about my donation. And then I recently read in the National ALS newsletter that a researcher, Dr. Rosa Rademakers, working at the Mayo Clinic in Jacksonville, Florida, I never knew they had one there, had discovered the second ALS gene, now known to be the most common cause of ALS. The mutation accounts for about 1/3 of all familial cases of ALS. Incidentally, it took 19 years to find the second gene. The first gene, which was named SOD1, had been discovered by doctors Robert Brown and Tipu Siddiq in 1994. I was told after the recent discovery that my $100,000 donation had been used by Dr. Rademacher to fund the major part of the cost of her research to discover the new gene. What a marvelous feeling that was, to think that I had donated perhaps a big step towards finding the cure for ALS. I now know that funding medical research is not like throwing money down a hole. Next time you're trying to raise funds to find the next step towards the cure for ALS, think of this incident. Thanks so much for listening to me.